Hello and welcome. Now hear this. This week marks exactly 10 months to the countdown of the general election, but it also marks another day when the country, and need I say the globe, is grappling with a global health crisis. So will our election be postponed, or should we just go ahead and conduct it? And if so, what measures will be put in place, and at what risk will we be putting ourselves into? To have this discussion, we'll have experts both health and governance. My name is Lincoln Ombogo and you're watching Frontline. The COVID-19 pandemic continues to put a strain on the electoral democracy across the world, with the pandemic changing the electoral cycles from how campaigns are conducted to even during the voting day. Our reporter Harriet Chimea, with the help of Shilling Teach, have compiled a series of the situation from various countries across the globe that have conducted referendums and national elections amid the pandemic.
As the clock continues to tick, now even faster than ever, the country is just 10 months away from having its general elections. We decided to quickly take a look at the election cycle from across the world, from when the pandemic hit in February 2020 to August 2021. At least 79 countries and territories across the globe decided to postpone their national and subnational elections due to the COVID-19 pandemic. Another 132 countries and territories have decided to conduct their elections despite concerns related to COVID-19. Then how did they do it, and what lessons shall we learn as a country? Let's take, for instance, the United States elections in 2020. Presidential candidates had to get creative with their campaigning strategies. Rallies were being held virtually and door-to-door hard selling. And for the first time, the country saw an increase in mail-in votes across the states, bringing it closer home to Africa. The northern region of Tigray proceeded with parliamentary elections despite Ethiopia postponing the elections due to a surge in COVID-19 infections. On the other hand, Burundi conducted its elections, downplaying the coronavirus threat. However, election observers were put under 14 days quarantine upon arrival in the country. Be that as it may, challenges of voting in the pandemic were also witnessed. In the just concluded Zambian elections, politicians turned to large roadshows, campaigns, supporters and politicians completely defying COVID-19 regulations. In India, during their elections, a steep rise in the number of infections were witnessed as political campaigners and candidates were also seen not following COVID-19 safety protocols. In fact, India's ruling party continued to reject the link of the surge in infections to the rallies being held, and we all remember the effects that followed. Even as Kenya heads into an electioneering period in 2022, ideally for safe elections to be held, here are some safety tips. Strict wearing of masks by the voters and officials, checking temperatures at the polling station, together with provision of hand-washing stations, social distancing as voters queue to vote, disinfecting polling stations while ensuring routine disinfection of frequently touched surfaces and other sanitary measures, minimizing the number of people who vote at the same time, among other measures. In Poland, polling stations were allowed to air out for 10 minutes every hour. In fact, French officials took it a notch higher as they encouraged voters to bring their own pens. In Suriname, poll workers used cotton swabs to cover voters' fingers with ink instead of letting people dip into shared ink pots. In Croatia and France, proxy representatives were allowed to vote on behalf of coronavirus patients and those in isolation. Elsewhere, election staff and health professionals visited patients in homes. In Singapore, the elderly and other high-risk individuals were encouraged to vote early in the day. Will Kenya, 10 months down, fall in this list?
To have this discussion, I'm joined by a governance expert and also the executive director of the County Governance Watch, Kevin Osido. We are also joined by health expert and secretary general of the Kenya Medical Association, Dr. Simon Kigondo. Gentlemen, shall we? Thank you for creating time.
Asante.
Let's get to it. Are the gains we've made as a country against the fight on COVID-19 being derailed by politicians? Perhaps we could start with you, Simon.
I think as a medical fraternity, we have warned against political activity that could act as super spreader events for COVID-19. And therefore it is upon the Kenyan to judge as to whether political activity put them at risk of, for instance, transmitting the virus. Politics also affects other areas of vaccine supply, of health and treatment, of human resources for health, and therefore, of course, politics does have a very big impact on health in general and COVID-19 in particular.
Doc, the situation on the ground, so that we can now get a scope of what's happening. Where we have witnessed by-elections in the country, what has been the COVID-19 situation impact after the by-elections?
I think it is obvious. Our measure of the impact of that is usually what happens 2 to 3 weeks or even 4 weeks after a by-election.
What happens?
And the fourth wave happened after several by-elections. So that may be an indirect pointer to what political activity can do to the COVID pandemic.
Kevin,
yes.
You've had what the doctors had to say. The situation has been bad. After every by-election, we've witnessed a surge in numbers in COVID-19 cases, a surge in numbers in deaths as a result of COVID-19. Kevin, what can we learn from these and also other parts of the world where they have held elections, including the United States? What can we learn as a nation?
Quite fundamental and profound lessons. And these lessons are lessons that really boil down to the aspects of the electoral cycle. And if you look at what, for instance, in our country we do during elections is to give the responsibility to IEBC. Because the Independent Electoral and Boundaries Commission is the electoral management body that is really charged with preparing electoral process from rather before, during and after the elections. I don't think I want to compare the United States and Kenya, because for instance today we are talking about almost 83% of totally vaccinated citizens of the United States. In Kenya, we are still struggling with issues of narratives, motivating people and encouraging people to go and get vaccinated. We are still struggling with issues of donations from other countries of vaccines to want to give to our citizens. We are struggling with issues of explaining to the citizens what AstraZeneca means and whether you need to have the first or the second of AstraZeneca, or what Johnson & Johnson means and how many of those you need to be given as a citizen. Now, in the midst of all this, there is also the question you asked around the politics, and we have not seen politicians helping the Ministry of Health and doctors to be able to explain these issues to the citizens and also working together with IEBC. And this therefore really leaves us at a very difficult moment as a people, because then it puts the question around how prepared we are to be able to deal with campaigns that then, as Dr. says, are super spreader events. You want to go out there, and in Kenya we have this notion that the more people you are able to drive into a rally or into some small market somewhere, the best candidate you can be, and then the best case scenario for you to get elected. But we are not preparing these citizens around the consequences of what we are calling lack of social distancing. We are not encouraging citizens to go out there and get vaccinated. We have parliamentarians, elected and nominated. We have senators who have failed to work together with the Ministry of Health to boost COVID-19 vaccination rates, even in their own constituencies. And so when you talk about lessons that we can be able to learn, I think it would therefore be fundamental upon IEBC to come out very strongly on this issue, and also work with other friends of Kenya, like the United States of American Embassy in Kenya, to begin to share lessons and how they were able to have their elections. Our CS Interior flew and he was sent by the president to Zambia. Zambia just held its elections a few days ago, and the president was sworn in yesterday. This is closer home than the United States because it's in Africa. So you want to look at the ratings of COVID-19 in Zambia and Kenya, and how Zambia has really done very well to have an uncontested election in the midst of COVID-19 and have a president being sworn in, and then how they've really managed. So we hope that when CS Matiang'i comes back home, and because he's other than IEBC, I believe that his ministry is the one that's really charged with the highest responsibility to ensure that elections are safe, secure, and that they are also effective. So we hope that he's not just having tea in Zambia, but that he's carrying good lessons that can help IEBC to have effective elections in the midst of COVID-19.
Thank you, Kevin. Dr. Simon,
Yes.
please paint to us a picture of what is currently going on in hospitals, ICU beds, hospital beds, oxygen facilities. Please paint to us that brief picture.
Yeah, so COVID-19 is serious, and I think we've started seeing some of the data in the hospitals being displayed. Like a hospital would go on social media and say we have 20% ICU full of COVID, we have 30% and all. But when people get severe COVID, they tend to initially when we started, we said that out of 100 people who get COVID, 90% will be fine. They'll be okay. They may be asymptomatic, you may get flu-like symptoms and all. The other 10%, 5% of them may progress to severe disease. So initially there were few numbers. Therefore, if you get 100 people with COVID, only 1 to 5 will require ICU, and I think we have 5 ICU beds. But now when it entered that community, so you have 100,000 people exposed to COVID. If you do 5% of that, it is 5,000, and our ICU beds are 400. Let's say, you get what I mean. So you get ICU beds saturated with people requiring support. Now what happens is that now ensures that other normal diseases, so to speak, do not have space for treatment in hospital. And being an obstetrician and a gynecologist, a lot of maternal and neonatal healthcare suffers. So you get a double burden. The one who needs ICU cannot get an ICU bed. Let's say you have bleeding after delivery and you need an ICU to survive you for 4 days, 5. Then you get out, but the bed is filled with the COVID. So you get 2 problems. The COVID one is unwell, the one cannot get care. So the aim of managing COVID is to prevent overwhelming the health system with critical patients who take up a lot of the resources. They are few, but take up all the resources literally, and the resources are not enough. And that the picture of COVID and is dire. We have, I'm sure if you call 10 people, 5 will have known someone who may have contracted and passed away from COVID. And of course, for the doctors, we know more people because we see them every day, and it becomes very difficult. So in our forums, you'll always find, where is an ICU? Where is a COVID bed? I have someone who, you see. So that points to a dire need for healthcare, and points to that the disease is overwhelming our health system.
Kevin,
Yes.
should we go ahead and conduct elections? The situation, according to Dr. Simon, is dire.
You know, that's a very difficult question because how we test the sovereignty of the people and the democratic progress that a country has undergone through is purely based on certain parameters, and that one of those parameters is the ability to conduct an election, because that's how you provide for transition from one government to the other, and also allow for citizens to exercise their sovereign power, and our constitution gives that sovereignty to the people of Kenya, and that constitution says that on the second Tuesday of every 5th year in August, we will have an election on the second Tuesday, as I said. So what therefore happens is, if we can be able to effectively put in place mechanisms to deal with the spread of COVID-19, and also ensure that we are prepared, like Dr. says, in terms of whether we will need ICU beds, I don't think we have done very well. Because if you look at the president's narratives with governors, he asked them actually that every county by a certain date should have put in place 300 ICU beds. And I don't think, from what we see in the counties, we have those. From what County Governors Watch exactly sees from the counties, I don't think we have that amount of beds, ICU beds out there. The second thing, of course, is the Africa Union pronouncement around elections, that they said if countries have a feeling that they're not prepared to have elections because of COVID-19, then they are free to postpone those elections. But then you see, when you speak at that very high level, as Africa Union and the Africa Union Court, the question is, one of the parameters of making such decisions, for instance, in the Republic of Kenya, is public participation. And now we are eating from the pains of BBI, where a process that has been going on for 2 years was actually just, closed by certain pronouncements in a court of law. And one of those reasons why that process was stalled was because of lack of proper public participation. So the question then is, how then do those pronouncements by such high-level regional courts like the Africa Union Court play within the parameters of the borders of the Republic of Kenya? So looking at those kind of things, I do not think that even Kenyans are ready to have a postponement of elections, particularly if you look at how this government has performed in dealing with COVID-19 and also just socio-economic issues. I don't think Kenyans will want to see another single day of Ruto Uhuru presidency. Yeah.
Let's take a short commercial break. The conversation continues shortly. Stay tuned. Kenyans of time.
As for politicians, perhaps it is worse, because what you are supposed to be providing is leadership on saving Kenyans, leadership on Kenyans being vaccinated, leadership on wearing masks, leadership on keeping social distancing, leadership on keeping on washing your hands. This is the leadership that Kenya right now needs, because it is a leadership that can save their lives, and it is a leadership that can cause continuity of economic activities. But when we pretend that if you go and stop by markets, if we pretend that there is no effect, that there are some people who can go to a marketplace and cause the spread of COVID-19, and some other people who will go to the same place in the marketplace and do not cause COVID-19. I would like to see that formula. I would like to get educated in that area. Because as far as I know, either you are part of the solution to this problem, or you are part of the problem itself. And what we are saying is that what we are looking for is leadership towards resolving this problem.
Yes, Mutahi Kagwe rant. He's mad at politicians. Dr. Kigondu, what do you read of that?
So, he's right. He's commenting on a situation that he has seen. And as a leader, a politician has a lot of responsibility. And if guidelines are given on how, for instance, to prevent the spread of disease, and you do not follow them, then you take responsibility. The people also listening to you take responsibility, one, for being there and maybe not following the guidelines. But I think it would be very superficial just to say, oh, leaders, take responsibility. We must answer the question, why do leaders come out in public to mobilize people? So if you don't answer the basic question, then telling politicians not to convene rallies, not to talk to people, to control is null and void.
Null and void. Kevin, Dr. Kigondu says it's null and void, and he's asked a very complex question. He says it's basic, but I think it's complex. Maybe you can help us understand, why do politicians come out in public, mobilize people in the midst of a pandemic that's killing people?
This is happening because it is 2021. We are in September, right? Mm-hmm. And it is 10 months.
Just 10 months.
To the next general elections. If this was happening in 2020, September, we would not see this kind of drama. If this was happening in 2019, September, we would not be seeing this kind of drama. But this is happening because people are gearing up to the next general election. And as I said earlier on, how elections are done in Kenya is based on the number of people that will be portrayed to the people through either newspapers or television screens and or social media pages of these politicians. Now, what the CS has failed to do, in my view, is to be very categorical with the political class. There is nothing that stops the CS Health to convene the politicians at KICC or at State House or at Harambee or even at Afya House and tell them, ladies and gentlemen, this is the statistics. You held a Jamhuri Day in Kisumu before 3 weeks, this is how it looked like. After the event, this is how it looked like. Mheshimiwa Deputy President, yesterday you had more than 1,000 young people at Karen in a tent. Before this meeting, this is how it looked like. And so 14 days after your meeting, this is how the statistics look like. Mheshimiwa Raila Odinga, you had Meru leaders yesterday in a tent somewhere in Meru. This is how the statistics look like, and this is how we project that after the 14 days of incubation, COVID-19 will have affected the country. And then give them the choice whether they want to go to an election where people will have died, and then we ask ourselves, so who will vote for you when the people that you are convening die? The third thing is to look at the policies that the CS Ministry of Health has put in place to working together with the legislatures, because it is the responsibility of Parliament to safeguard the lives of Kenyans. Mm-hmm. And if they, for instance, talk about masks, and people are walking around and policemen arrest them and they bribe the police and then they go away without serious punitive measures, including the stories that we have just watched, some of those people are not masked up. What has the Ministry of Health done in unison and partnership together with Ministry of Interior to ensure that those who are not masked up are taken and seriously whipped in public, so that people actually see how government is very serious and stern with the same vigor that the CS is talking, and that kind of force, so that people can actually see that kind of seriousness. The last thing, citizens of Kenya need to know that the politicians that they are interacting with have been vaccinated. The Deputy President, in all his meetings, I see him shaking people's hands. This is a gentleman who has been vaccinated, you know? And you are shaking hands with people that you probably are not aware whether they have been vaccinated or not. The former Prime Minister contracted COVID-19, and he said he went into quarantine, and after 14 days we saw him jogging, and then he said, I have now, even the day he was vaccinated, he was on public, you know, receiving his job. So Kenyan citizens should stay away from people who have been vaccinated, especially if they know that they have not been vaccinated, because otherwise there will be nobody to vote.
There will be nobody to vote. Dr. Kigondu, we are going into an electioneering period. As in your office, in your position, what percentage of the people who are going to vote should be vaccinated for us to go, for the citizens of Kenya? What percentage of Kenyans should be vaccinated for us to go to elections?
So I think COVID 19 has been with us for at least a year, and we have had 2 doses of vaccine. 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 And we have lessons. We have actually learned our lessons. And maybe just to bring the context is that Kenya, by the way, has the best response to a pandemic. It had. And a lot of people came to learn from us. The only problem is that we got stuck in the response. So, for instance, when we had what is called treat. You do surveillance, look for people, test and treat. That was the best policy, but that is meant to go on for some time until where you have a permanent solution. So what we are saying is that COVID is here to stay. Yes. So what is the solution? So the solution lies in the health system. And the health system being that the health system should be able to treat you if you get severe COVID so that you survive, and it should be able to. Two, the health system should prevent the spread of the COVID-19. And finally, then we are looking at a system which we have said that if we get a lot of people vaccinated, then we are able to open up. You know, you are fighting against livelihood, you see? Yeah. So you cannot, a disease that is not going away, you must look at livelihood. So the target would be to vaccinate 25 million Kenyans.
At least.
In fact, if all the vaccines just came vaccinated, then open the country in 14 days. You see, and that's the target, and that's what we should have. And what is a good example? Manchester United, Premier League. You know, the stadium is full and no one seems to be worried about COVID.
Because they're vaccinated.
Because they're basically, they say this is our science shows that if you're vaccinated, then you're able to interact. And guys are back to livelihood while you are still there saying you can't have election. Yeah. But my point on election is that we should go digital.
Let's go digital.
Yeah. Why do we have to make a line to vote for people? We should vote from home.
Thank you. That has been governance expert and executive director of the County Governance Watch, Kevin Osido. Also with us has been health expert and secretary general of the Kenya Medical Association, Simon Kigondu. Now we'll leave you with this expert view on how COVID-19 is being spread quickly in the city. My name is Lincoln Ombogo and this is Frontline. Till next week, same time, stay safe.
You don't know the next person, whether they're the ones who are carrying the virus. So from rails touching surfaces in public and people touching the surfaces, not wearing your mask, those then poses a risk, because then you can contract the virus, because even maybe your best friend has it and they have no symptoms.